WHO recommends that mothers with suspected or confirmed COVID-19 should be encouraged to initiate or continue to breastfeed. Mothers should be counseled that the benefits of breastfeeding substantially outweigh the potential risks for transmission. Recommendations on mother-infant contact and breastfeeding must be based on the full consideration of not only of the potential risks of COVID-19 infection of the infant, but also the risk of morbidity and mortality associated with not breastfeeding, the inappropriate use of infant formula milks, as well as the protective effects of skin-to-skin contact. This scientific brief examines the evidence to date on the risk of transmission of COVID-19 from an infected mother to her baby through breastfeeding, as well as evidence on the risk to child health from not breastfeeding. A total of 46 mature infant diets had breast milk samples tested for COVID-19. All mothers had COVID-19 while 13 infants tested COVID-19 positive. Breast milk samples from 43 mothers were negative for the COVID-19 virus, while samples from 3 mothers tested positive for viral particle by RT-PCR. Among the 3 infants whose mother's breast milk test positive for viral RNA particles, not live virus, 1 infant tested positive for COVID-19, but infant feeding practice were not reported. The 2 other infants tested negative for COVID-19. 1 was breastfed, and the other newborns was fed expressed breast milk after viral RNA particle was no longer detected. In the 0 child with COVID-19, it was unclear through which route or sources the infant became infected. Example, through breast milk or droplet from a close contact with the infected mother. The infection of COVID-19 from mother to child through mucus, not breast milk, from scientific data of WHO. In the case of women who has a baby takes favipiravir or Andrographis paniculata, the project was studied in animals so that it can process the placenta and increase into the breast milk. It has many effects on an embryo, such as deformities to form organs or development. Therefore, people who take this must be breastfeeding after 48 hours of injections and expressing breast milk during a bit of time to promote breast milk creation. By the way, breast milk pumping takes times about 10 to 15 minutes, not take time so long, over 15 minutes by its size, because in this process can induce a mastitis. Breastfeeding process. Preparation before breastfeeding has 3-step approach. Firstly, wash your hands with 7 steps before breastfeeding with soap and water. I use a hand sanitizer with at least 60% alcohol. Then, wear a mask with or without face shield during breastfeeding and whenever you are within 6 feet of your baby. Lastly, wash your hands like a first step approach after breastfeeding. All in all, to prevent secretions from mother to child. Warning: no wearing a mask or face shield for a baby because it is difficult to breathe for a baby. Thai society recommended mothers should breastfeeding after take a bath due to a good hygiene. Cleaning process of breast. Begin with cleaning nipples to breast by a warm cloth or napkin within 2 times. After that, use a clean cotton to clean it or let it dry. Do not aggressive scrubbing. It can lose skin moisture and dry skin around breast. Afterwards, mother can breastfeeding in any position as she good at it, and if she want to express breast milk, clean or part of the pump that come into contact with breast milk.